Right. Well, I want to welcome you to Seattle Pacific University's 2021 Sigma Theta Tau induction ceremony. My name is Desiree Hoffman. I serve as an assistant professor of nursing in the undergraduate program, and I have the privilege of serving as this year's school counselor. I am excited to join you in honoring our students today and the hard work and dedication they have demonstrated to be invited into the International Nursing Honor Society. Before we proceed with our program, I'm just going to ask that everyone keep their microphones muted to help eliminate background noise. As noted in our program, we will be recording this ceremony so that those who are unable to join us can also celebrate the achievements of our inductees. Now, I would like to invite Dr. Antoinette Lee, Interim Dean of the School of Health Sciences, to provide some welcome remarks. Dr. Lee.
Oh, thank you, Desiree. So greetings to everyone. I am Antoinette Lee, and I have the privilege of serving as the Interim Dean for the School of Health Sciences and the Lydia Green Nursing Program. So on behalf of our faculty and staff, I would like to welcome each of you to the Sigma induction ceremony. It's wonderful to be here with you and to celebrate your accomplishments. And for more than 90 years, Sigma has been recognized and celebrating excellence in scholarship, leadership, and service within the nursing and midwifery. To the parents, spouses, children, families, I offer my congratulations to you as well, because without your support, the inductee would not be here today. So it's an honor to be inducted to the Honor Society of Nursing, and I'd like to congratulate all of you on achieving this honor. Welcome.
Good morning. I'm Erica Boos. I know many of you here because I'm also faculty at SPU, but I have served as president of the Sigma Psi at Large chapter for the past 2 years. My term actually ends the end of next month. And then there will be our new president, who is currently president-elect, coming in. That will be Ann Mulligan, and she is coming from Olympic College and also teaching at UW-Tacoma. It's my privilege to do this one in person. I've actually, for all the other schools' inductions this year, they've got a pre-recorded version of all of this. So my remarks right now are a little more extemporaneous. But I'm really happy to see you all here at the end of what's been a most unusual and interesting year for all of us. So appreciate all the leadership that is shown by this group that is coming into our chapter, and we are very, very excited to have you. A little bit of just background on our chapter. We've been around for, oh gosh, I have lost track of how many years, but a very long time. And one of the earlier chapters out of, oh gosh, 500 or so chapters. And we are, I believe, number, oh gosh, I should remember this, like we're number 21 out of all those chapters. So we've been around for a long time. We are well established. We have 7 schools represented by 1 chapter. So that makes for a great opportunity, also makes for great challenges in communication between 7 different schools. So you are joining a fairly large chapter. And so we are always looking for people to want to get involved. And honestly, for any professional organization you're going to join, what you put into it is what you will get out of it. So just encouragement to really think about how and where you want to invest your time, looking for leadership development, looking for networking, looking for just your own personal growth as a nurse. Sigma offers all of that, along with other organizations that you may choose to join. You may join a specialty organization based on where you are working. You may already be there for many of you, or those of you just coming in as undergrads may be looking to join a specialty organization. But keep in mind that Sigma really is an umbrella organization that represents nurses everywhere. We are global, and it's really a very cool thing to get to go to any kind of Sigma conferences and things, and to really recognize just that we are not, we do not represent the United States, we represent the world. So it's a really, really a unique organization that way. So I became a Sigma member when I was an undergraduate, and I was just sitting here thinking when that was. And I'm a little like appalled at how far back that is now, because it was the fall of 1988 when I became a Sigma member, as in my last year of nursing school. So it's been a long time, and I was not active for quite a long time. but picked it back up within this last decade. And it's been really tremendous, the opportunities it's given me to connect with other leaders and to just grow in my own leadership skills. So I highly recommend you accessing the the resources that Sigma offers online. There is so much in there. It takes a little bit of digging around in that website. I'm not going to lie. But there's so much available to you as a nurse, and so many ways you can network with other people in your specialty areas. So I would encourage you to really take a look around there. Sign up for the different discussion boards that are out there, because you can connect all over the world with people, and which is really kind of a cool thing. So before I move on here, I did have prepared remarks from the recorded session, and I'm not going to go through all of those. But I just want to read this last little section before we move on. And then I'm going to be just telling Desiree when to change the slide. So bear with me on that piece. But here's just the last little tidbit of this, just kind of wrapping up what this past year has really brought for nurses. It is heartbreaking to know that some have been broken by this pandemic, and most have needed to take pause to account of the incredible amount of personal strain that they've been living through under this time through pandemic and social upheaval, both of which have required nurses to dig even deeper into our physical, emotional, and mental reserves. We are resilient, and these events will hopefully develop more of those characteristics in nurses in a way that continues to move our profession forward. Nurses understand what nurses go through, and in this, we need each other to come alongside and lend strength and compassion through these difficult moments. So that was just the little ending piece, and I'm going to segue slightly awkwardly here into our next slide. So we're going to begin our induction. So for more than 90 years, Sigma has been recognizing and celebrating excellence in scholarship, leadership, and service within nursing and midwifery. Next slide. The Honor Society, today known as Sigma, was founded as Sigma Theta Tau, or some people say Ta, there's lots of debate around which way you pronounce that word, was founded in 1922 by 6 nursing students at Indiana University. From those 6 founding members, our organization has grown to more than 135,000 active members in more than 540 chapters in over 100 countries around the world. Next slide. Sigma also collaborates with several global organizations to improve the health of the world's people, including representation at the United Nations. This offers members the opportunity to extend their reach outside of their own communities. We are excited and filled with pride today to welcome our new inductees into our diverse and global membership. Sigma leaders are leaders at all levels of the healthcare industry. The Society only extends membership to students in baccalaureate or graduate level programs who have demonstrated superior academic achievement, academic integrity, and professional leadership potential, and to nurse leader candidates exhibiting exceptional achievements in nursing. Our membership includes top-notch nursing executives, clinicians, educators, researchers, policymakers, entrepreneurs, and others. You are among this distinguished group of nurses, students, and professionals who have met or exceeded the standards required to receive an invitation to join Sigma, and you truly deserve our congratulations. Next slide. The leadership and scholarship that you have displayed represent the essence of the Society. Together, we are Sigma. Next slide. Our founders chose the Greek letters Sigma, Theta, and Tau, taken from the Greek words meaning love, courage, and honor, as they believe them to be the enduring values that are the root of the nursing profession. Next slide. Our crest, which adorns your membership certificate, symbolizes these enduring values, reminding us of our commitment to wisdom and discernment, as represented by the I, service, professional endeavor, and strength of leadership, as represented by the pillars of stone at the right and left, and knowledge, as represented by the lamp. Next slide. Our key, embedded in the membership pin, reminds us of our charge to uphold love, courage, and honor, and is a symbol of scholarship. The cup denotes the satisfaction of professional life. The circle with 6 stars represents our 6 founders. The lamp is the lamp of knowledge, and the letters in black represent our charge. Remember that our key symbolizes your commitment to nursing excellence. Next slide. The purpose of this ceremony is not only to honor you as a new member and celebrate your successes, but it also serves as our pledge to you to support you throughout your nursing career and to be a lifelong resource for you. This support will come in part through the opportunity to participate in Sigma's communities of interest, mentoring programs, and academies. You will also have access to benefits such as continuing nursing education courses, the Journal of Nursing Scholarship, Worldviews on Evidence-Based Nursing, and Reflections on Nursing Leadership. Next slide. Your induction is not the end, the culmination of your scholarly or professional achievements. Instead, your induction signifies the beginning of your membership journey, the start of your involvement within a global network of peers and mentors who are here to guide and support you wherever your nursing career may take you. So I want to welcome you all as you are coming in to this, this organization. And for those of you coming into the profession for the first time, we welcome you. We need you desperately. And for those of you who are moving on and up in your nursing path, we also need so much of that. So we are so proud of all of you. I'm going to pass on here, I think, to Desiree and let her carry on again. So welcome to all of you.
Thank you, Erica. So next we are going to have all of our inductees unmute themselves. And I know this can get a little weird whenever we have everyone read at the same time, but this is the pledge. And so if you could unmute yourselves, and you might hear some different timing, and that's okay, but I will lead us off. So I accept membership in Sigma Theta Tau International, and I pledge to fulfill its commitment to nursing excellence, knowledge, service, and leadership throughout my career. Thank you. So welcome to Sigma. I am now going to pass this on to Dr. Christine Hoyle. We have invited her as Associate Dean for Graduate Nursing to be our induction speaker, and her message is entitled Leading Change, Advancing Health. So please join me in welcoming Dr. Hoyle.
Good morning, and thank you for this opportunity to share a few words and to celebrate with you this honor of being inducted into Sigma Theta Tau International. As you have just heard, Sigma Theta Tau's vision is to connect and empower nurse leaders, creating a global and community through promoting nursing scholarship, leadership, and service, ultimately impacting and transforming healthcare. The impact of your leadership will be felt as you dedicate yourself to nursing and to the work to improve the health of all entrusted to your care. Many of you may know that nursing has been listed as the most trusted profession since the inception of the Gallup poll in 1999, except for 1 year. Following September 11th, firefighters ranked #1. The World Health Organization declared 2020 the International Year of the Nurse and the Midwife to honor the 200th anniversary of Florence Nightingale's birth and to advance nurses' vital role in transforming healthcare around the world. The American Nurses Association joined our global colleagues in extending the Year of the Nurse and Midwife into 2021 because of the impact of the pandemic and the increased visibility of nurses' contributions. The pandemic has highlighted the major contributions that nurses bring to our healthcare system. We have been at the bedside, in the policy boardrooms, community and public health outreach, all impacting the care of the individual patient, family, population, and the community in which we live. In 2011, the Institute of Medicine came out with a landmark national report, The Future of Nursing, Leading Change, Advancing Health. This report explored how nurses' roles, their responsibilities, and education needed to change significantly to meet the increased demand for care created by healthcare reform and to advance improvements in our increasingly complex health system. The message was for nurses to be able to practice to the full extent of their education and training and be full partners with physicians and other healthcare providers in redesigning U.S. healthcare system. This was more than evident as we tackled the COVID-19 pandemic in this past year, demonstrating the power of teamwork and a unifying goal. We needed to find a way to meet patients' needs efficiently, putting aside battles about what types of care to place where, adopting new care models, including telehealth, nurse practitioners being able to practice to their full scope in states that did not have full practice authority. Many lessons have been learned as we collaborated and worked together to improve the healthcare outcomes of our patient populations. To move forward, then, we must now capture the urgency and the learning that COVID-19 has triggered. Each of you, as our first future nurse leaders, have an opportunity through practice, scholarship, research, service, and leadership to be instrumental in moving our healthcare system forward, improving the healthcare outcomes of our patient populations, and achieving the goal of health equity. On May 11th of this year, the National Academy of Medicine published an updated report, The Future of Nursing, 2020-2030, charting a path to achieve health equity. The report notes that nurses have a critical role to play in achieving the goal of health equity. Nurses, through their multiple roles in acute and primary care, community, and public health, can influence the medical and social factors that drive health outcomes and health equity. As we think to the future and the roles each of you will play, let me briefly describe 5 key areas the committee addressed in strengthening the nursing profession to meet the challenges of the decade ahead. Number 1, there will be an increased demand for nurses as major stakeholders to impact the health and well-being of the nation due to the health needs of an aging population, increases in behavioral and mental health conditions, lack of access to primary health care, high maternal mortality rates, and worsening physician shortages and other socio-demographic factors and health workforce imbalances. Number 2, lifting barriers to expand the contributions of nursing. This includes lifting state-level regulations restricting the scope of practice for advanced practice nurses. This will allow advanced practice nurses to practice to the full extent of their education and training, increasing the types and the amount of high-quality healthcare services that can be provided to those with complex health and social needs. Also, lifting institutional barriers for all nurses to practice to the top of their education and training. Number 3, valuing community and public health nursing that play a vital role in advancing health equity. The COVID-19 pandemic has heightened the need for team-based care, infection control and prevention, person-centered care, and other population-based skills that reflect the strengths of community and public health nurses. Number 4, fostering nurses' roles as leaders and advocates. A new generation of nurse leaders from all roles and settings is needed that recognizes the importance of diversity and equity, integrating into healthcare practices the increasing evidence of the link between the social determinants of health and health status. And lastly, preparing nurses to respond to disasters. As we have witnessed, the COVID-19 pandemic has revealed major gaps within an already fragmented U.S. healthcare system. This has led to increased mortality and morbidity, along with health inequities. The role and responsibilities of nurses in disaster response and public health emergency management will continue to grow as the nation plans and responds to ongoing disasters and public health emergencies. To quote the committee report, nurses are bridge builders and collaborators who engage and connect with people, communities, and organizations to promote health and well-being. I encourage and challenge each of you to be a nurse change agent, leading through scholarship, service, and practice to impact the health of your patient population, improving health equity and our healthcare system. Thank you and congratulations to each of you.
Thank you, Dr. Hoyle. So inductees, we've come to the point in our program where we officially recognize each and every one of you. And while not everyone was able to join us today, I would like to read the names of all our inductees. And then after reading the names, I'll switch to the gallery view on Zoom. And if you are present, please wave or stand so that we can recognize you. And guests, feel free to celebrate our inductees by making visible signs of encouragement, by clapping, giving a thumbs up or smiling, etc. This is a moment to celebrate. So from our BSN program, Maya Davis, Talia Ferguson, Catherine Holt, Chan Huang, Adrian Leonard, Hui Jean Liu, Muskan Priya, Yamisha Singh, Gabrielle Stegmuller, Michelle Stipe, Morgan Timmons, and Bianca Vieira. And from our DNP program, Alam Daking, Annie Linda Huanju Baju, Hannah Kim, Karen Lee, Glenda Shepard, and Zhao Ying Candice Zia. Congratulations. Each biennium, Sigma installs a new president at the international level, and in 2019, Dr. Richard Riccardi was introduced as the 33rd president of Sigma. To help guide members and chapters to strive to fulfill our mission to develop nurse leaders anywhere to improve healthcare everywhere, he asked us to infuse joy into all we do. In a year where the pandemic has changed so much in our lives, I am filled with joy knowing that nursing's future is bright with leaders like yourself caring for our community. So congratulations again to our newest members on leading change and advancing health. And thank you all for joining us at this year's Sigma induction ceremony. Thank you all for joining us. It is such an achievement to celebrate, and so we congratulate all of you on just demonstrating your dedication to our profession and just your commitment to excellence. And so congratulations again. We will be posting this recorded video to, I believe, our SPU nursing website. And so we just want to thank you all for being here today. And yeah, we just look forward to everything that you will accomplish in our profession. So thank you.
Thanks, Desiree and Erica.
Welcome.
Thank you everyone for attending today. Congratulations. Hope to see you coming into the chapter, taking advantage of the things that you can do. And we would love, we're always looking for people to come and join us and to help carry the load.
Thank you. All right.
Have a great day, everyone.
Congratulations, everyone.